We don't know why. So we know that even when African American patients with hepatitis C, even when we follow them very closely, we screen them for liver cirrhosis, they do everything religiously that they're supposed to do. On average, we're still diagnosing African Americans with liver cancer at an earlier stage in the evolution of their disease than, Caucasian Americans, for instance. We also know that they tend to present with more advanced stages of their disease when you compare person for person. Not very sure why this is happening. This is being investigated by oncologists and people who do, those of us that research this. I think part of the reason is that there's an interplay, right, of factors. So we talked about how, unfortunately, we have a higher risk of patients having diabetes, being obese, and then putting hepatitis C on top of that. So whereas maybe other communities may have just one risk factor that their liver has to deal with, our livers are having to deal with maybe a multitude of factors. Maybe there's some genetic reasons. Not we. I wouldn't go to that area. I really think that it's really more a bunch of environmental reasons, like diabetes happening in the same person, and obesity, and then hepatitis on top of that. But it's really not clear yet.
Having obesity, living with obesity is one of the risk factors for liver cancer, and not just liver cancer, I'll add, so other cancers as well. So maintaining a healthy weight is very, very important. And understanding your body fat percentage is important as well, because we know that there are some people that sort of have a different body definition. And so the body mass index doesn't tell us everything about a person. Some people are more muscular, I should say, I'm sorry. But understanding what your body mass index is and what you can do to get it within a normal range is very important, because yes, obesity does increase the risk of developing liver cancer. Potentially you are. So hepatitis C can lead to cirrhosis, and that's when there's the scarring and it's replacing the normal cells. It really depends where in that pathway you are at the time when your hepatitis C is cured. So if you have developed cirrhosis and your hepatitis C is cured, you are still at risk to develop liver cancer, because cirrhosis really is the strongest risk factor. There are other people that don't have cirrhosis, and it's much more rare or much less common for them to develop liver cancer. But let's say someone who's sort of pre-cirrhosis or in the earlier stages of having some scarring, but not quite cirrhosis, those people should still be followed until their specialist tells them they no longer need to be followed. The improvement in your liver once you're cured with hepatitis C can take some time. So it may take several years before all of the scarring kind of reverses. And it's important that you stay under the care of your specialist that treated your hepatitis during that time, so that we can find cases early should they occur. So type 2 diabetes is very prevalent, as you mentioned. Obesity is also very prevalent in our community. And together, those increase the risk of non-alcoholic fatty liver disease, which is fatty liver, which is actually quickly becoming one of the highest or strongest causes of liver cancer in the United States. But by itself, diabetes can increase cancer risk. Again, not to the point that just because you have diabetes means you need to be screened, but certainly you have diabetes might mean that you have higher risk of having cirrhosis, which is the risk factor. So it's not just having diabetes, but also poorly controlled diabetes. So there's some markers of how well your sugars are controlled. If you have diabetes, you should be checking your blood sugar. You should be talking to your specialist or your primary doctor about your sugar and whether or not you're well controlled, whether or not additional medications are needed to get you under control. Because having poorly controlled diabetes is a risk factor, not only for liver cancer, but many other health outcomes. That's another great question. And it's both. It's both. So there are some tests, and this isn't done commercially, but research has been done to try to understand why certain populations have a higher risk of fatty liver compared to others. Actually, the group with the highest risk of fatty liver are Hispanic Americans or Hispanics in general. And so there actually have been some genetic tests to examine why, and we have found some changes that tell us why they're at higher risk to have fatty liver and also to have progression, meaning they don't just have fatty liver, but they're more likely to have inflammation and scarring or cirrhosis. So again, like I mentioned before, there are few studies that include African Americans, so that it's really difficult for us to understand the genetic contribution in fatty liver disease. The other thing I also tell my patients is that diets run in families too. So most people eat the same thing that their parents ate and their parents ate and their parents ate. Every once in a while, you have someone who, does a complete, 180 from what their parents ate. But for the most part, we tend to eat the foods that we grew up eating. So people who have a certain diet or people who are overweight tend to be in the same family. They're clustered together. So that might be why we see this in fatty liver disease. It's partly because of lifestyle and culture. Our culture is so important. And so it might be because of that. But genetics definitely play a role in fatty liver. And we're interested in learning more about specifically fatty liver and Black Americans. Some people will have elevated liver enzymes and they should be seen. So, this is not something that we should assume, oh, well, my enzymes are just elevated because I worked out. But yes, in fact, extreme exercise, and I'm not talking about the typical, even daily exercising, shouldn't cause this. I'm talking about someone that sort of does extreme exercise, perhaps several hours a day, lifting heavy weights, lots of heavy training. So you may see this in athletes, for example. Then the enzymes can be elevated and it might be attributed to that as opposed to a liver disease. But whenever someone's liver enzymes are elevated, that is, liver disease is the diagnosis until it is excluded by doing other tests. So yes, certainly, if someone is run a marathon and gets blood work the next day, their enzymes might be elevated, and it might not be because of liver disease. But we should never assume that. We should always look to see why or why not, whether or not they get better on the next check when the person is not exercising, for example. Can I also just add a little? And you didn't mention this, or the question didn't, but one thing that I think goes along with exercise is supplements. So there are a lot of people who use supplements when they exercise. Some are like pre-workout or creatine, and there are some that are absolutely safe for people to take before they work out or during their workout. And then there are others that we actually know can cause injury to the liver. So it is related to working out, and I think it's something that we should all be in communication with our doctors to understand whether or not the supplements we elect to take are going to increase our risk of any injury to the liver. And if it's safe, then fine, by all means. But there are actually a lot of supplements. That's the number 2 cause of drug-induced liver injury in the United States is supplements that are for, dietary supplements, for example. So really important when we think about working out, we think about supplements, and those can increase the risk of liver injury. So the two things, one, again, the doctor that you're seeing or the healthcare provider that you're seeing should be at least annually checking your labs. If your labs are abnormal, they should investigate why your labs are abnormal, and they will do an ultrasound usually. That's the first thing that someone will do. Is non-invasive. It just looks at the liver, sometimes looks at other organs, and it can tell you whether or not the liver is fatty. Now, there are certain people that we know are increased risk of having fatty liver, and that would be someone who is obese or overweight, somebody who has diabetes. So even those people, if their enzymes are normal, it is actually reasonable to screen for fatty liver using ultrasound. And the reason is because those people may have normal enzymes, but they may actually have fatty liver and they may actually have some inflammation that's going to lead to scarring. So people with certain metabolic risk factors like diabetes, obesity, high cholesterol, those are all people that should likely get screened for fatty liver, because again, you're not going to feel anything. You're not going to feel any type of way because your liver is fatty. So it's important to use this objective information, labs, ultrasound, and whether or not your other medical conditions are risk factors. Really, unfortunately, not. These labs that I mentioned, any discomfort, I think I'd say, and this goes for any part of our bodies, when you talk about being Superman and Superwoman and ignoring things, we're not meant to feel discomfort, right? That we can't explain. So if you have discomfort in the right side or pain, that's not something to ignore. That's something to try to understand, why is it happening? It's one thing, okay, I've had an injury, I had a car accident, and I have this back pain, and that's why. Well, then you know why. But if you develop symptoms, pain in your right side, swelling in your abdomen, swelling in your legs, that's not normal. And you should understand why. So I think more importantly, we shouldn't ignore subtle signs that something's not right. But the liver itself is not going to necessarily flash a warning sign. So any discomfort, especially if it's present and it's persistent, is something that you don't want to ignore. You want to talk to your doctor about the fact that you have discomfort, and they'll usually get an ultrasound and see whether or not there's anything of concern. The gallbladder is also in that same area. And so it's important to look at that. So that was something that any doctor can order if you have discomfort. Absolutely. We are our own best advocates. So if your doctor is not ordering it, you should ask for it. Absolutely. You are the captain of the team. That's why I always tell my patients, you're the captain. So you should be asking for things. Now, maybe there's a reason. Maybe they did it last year and they know the result. But by asking for it, you can have that dialogue with them, and they can say, no, you don't need it because you already had it. But please advocate for yourself and ask for the screening test so that it gets done and you know your status. That's very important. Absolutely. There is hope. And I think the worst thing to do is to lose hope. It's normal to worry and to wonder. But when we become hopeless, we stop moving. And certainly there is hope. There are treatments available, but we certainly don't have 3 months to wait before we treat. So it's important that you process those emotions and get the help that you need, because every center will have resources, be it a social worker, be it a counselor, psychologist even. There are things that can help us to process as we move through this journey. And it's not just important for patients, it's also important for caregivers. So by all means, please take care of those emotions, but try to move forward at the same time and don't lose hope. The treatment landscape has changed so much since 2011, 2017. We have new treatments available and really better survival than in the past. So it is important that we not lose hope.